To kick things off, I'd like to introduce our Minister, the Honourable Jillian Skinner, who's going to say a few words. Our Minister's been a very strong supporter of all the good things that we do in the health system, and in particular inspiring us to do better with innovation and practice, and a very strong supporter of the work of the Agency for Clinical Innovation that I have the pleasure to head. So welcome, Minister, and I'd like to address us and open the day.
Thank you. May I start by acknowledging the traditional owners of the land, pay my respect to elders past and present. Can I thank you, Nigel, as well, and thank you very much for taking on the chairing of this day. I'm really looking forward to this day. I want to acknowledge all of the distinguished guests in the room. I think that we're bound to see some absolutely fantastic, innovative ideas that have cropped up from throughout the health system in New South Wales. And I, ahead of time, wanted to thank all of the fantastic clinical support staff who are here today and who are just a small representation of the wonderful people working in the system. Today is a very exciting day in New South Wales. I believe it's a day to celebrate the power of ideas, and those lovely clips that we saw as part of that opening video, I thought, were part of that inspiration. Each day, every one of us asks what else can be done to improve patient care in New South Wales. And even I, who I'm not a clinician, I wake up with that thought that really what we're working at is centred on getting better patient care. And I was just sitting next to one of our presenters now, who's coming up after me, and she was saying to me what really motivates her team is the knowing that they are going to make a difference to their patients. I think there can be nothing more motivating. So the inaugural New South Wales Innovation Symposium brings you all together from all over the state and from New Zealand. Thank you very much for coming over to showcase innovative work. You are shining a light on new ways of doing things. You have challenged the old, tested the new, researched, explored, collaborated, and today you come together to share. One of the best aspects of being Health Minister is the opportunity it allows me to go out there to hospitals and other health settings to see what you're doing. And of all the things that excite me the most are the wonderfully inventive, creative strategies you have developed to provide even better patient care, often without a whole lot of extra money, and in fact often using existing resources in a more efficient way. I've tried to tell the media this is what we are all about. It's about being more productive with the resources that we've got to ensure that we actually get better patient outcomes. And I want to tell you about a couple of the things that I've seen on my rounds of the health system, and there'll only be a couple. But some time ago at Wyong Hospital, I was in the paediatric ambulatory care unit there. I'd done a visit throughout the hospital, as I do when I make these visits, and I was very, very impressed with this unit. It was established 5 years ago. It has a paediatric senior doctor on duty 7 days a week. If a child comes in with a parent to the emergency department and they need to be seen, they can come up to the unit. They've got cover there until 10 o'clock, but they don't put patients in beds overnight. They send them, if they do need inpatient care, they go off somewhere else, but they go to Gosford. But if they're well enough to go home, they go home with the mobile number of the doctor and advice to the parents that they should ring if they've got any problems, and that they should come back to the emergency department if that can't be satisfied that way. They tell me that admissions have decreased dramatically despite presentations increasing, and they've had significantly reduced referrals to Gosford Hospital. Now, this is not unique to that hospital. It's happening in Nepean and Campbelltown and other places. But the whole idea really of having a day like today is to share these ideas. Also at Gosford Hospital on the Central Coast, the Aged Care Dementia Ward is where I met the volunteers who first of all signed up to help with a program in the dementia ward, feeding patients, helping them open those sandwiches, etc., etc. It was so successful that those volunteers were trained further to become supporters, and they spend hours with those patients, taking them for walks around the ward, helping them with toileting and other things where they need support, listening to them, a really important thing in patient care. And since that volunteering program had started, there had been absolutely no falls in that ward, which was a transformation. I could go on talking about many of these initiatives, but you'll see many of them here today. And so everyone can share the value of your innovation. That's why we put on this forum, but I'm also delighted to announce that today we will launch a new online tool, the Innovation Showcase, which is available on the New South Wales Health website. And I think we've got, here we are. If you go onto the website, onto the health website, you'll see a beautiful new front page. You'll be able to, in fact, it's got revolving entries, and you'll come to this one, the power of innovation. You can click on it. You'll see when you get into the site that it's got different menus there, and it's just in its infancy, but you'll see today's showcase. By the end of the day, I'm advised, all of your programs will be on that website. So I'm really thrilled to launch this website. I've been talking about doing this since the day after I became the minister. So as far as I'm concerned, it's a great milestone. And the advantage of this is that now, when I talk to people and I explain to them this great idea I heard, they say, oh, that's great. What else have you heard? This is a way you will be able to find out what's happening right around the system and further afield. And I think as it goes on, we can make it even more interactive. So I think it's an invaluable resource, a way to learn about the new models of care that are being developed and practiced by you and your peers. Today is a key element of health reform. Last year we began the process with a focus on the system. You all know the changes that have been made through the downsizing of the department to the ministry, the enhancement of the local health board and local health districts in the board structure, and I'm thrilled there are so many board chairs here today. We've enhanced the roles of agencies such as the Agency for Clinical Innovation, Clinical Excellence Commission, Bureau of Health Information, Health and Education Training Institute, and they are all playing a major role in providing support for the wonderful work that you are doing out in the health system. But nevertheless, despite all that, clinicians are the heart of activity in our system, and I'm very pleased to see all of you here today. Look forward very much to seeing the various programs that you're going to be showcasing and then coming to the awards this evening. I will be at the awards at this day all day and in the awards tonight, because I think this is where we really learn the excitement of those people who've seen a problem, thought laterally and come up with a solution that is going to provide by far the best healthcare we've ever seen. So I believe this is a fantastic day. The forum will provide new opportunities for you to take back to your workplaces, and I look forward, as I said, to hearing more about them. Thank you very much all for being here, and if I need to say anything to officially launch the day, it's said. Thank you very much.